Okay, so now I'm doing the anesthetic portion of the tear. I don't actually have the supplies, so I'm just pretending, but I have my sterile gloves on, my sterile feel, and my assistant is here with the light. And I have her take the lidocaine, hold upside down the vial, wipe the vial off with the alcohol swab, and I have my syringe, my 20 gauge 1-inch needle, this 2% lidocaine, and so I first pull back on the handle, and then I insert it and I fill it with air so that it's easier to come out. And then I take up about 2 cc's of the lidocaine. We have that now. And there's a couple different methods of insertion, but I like the Birthwise guide that talks about it, where you kind of do 2 different insertions, one on each side of the tear. So you insert the tear, and then you go up towards the apex of the tear, and then you want to, and before this you can dribble a little bit of the lidocaine on the edges of the tear just to help begin some of the numbing, or do a topical. So once I get to the position, then I'm going to pull back a little bit, aspirate to make sure I'm not in a major vessel, and noting if there's any blood. As long as there's not blood, then I can continue. So as I'm slowly withdrawing the needle, I'm going to be pressing down on the plunger, releasing a steady, slow stream of lidocaine as I come out towards the surface. But before I get to I don't come out all the way, I stay in, and I kind of do this butterfly technique. So I'm then changing the angle of the needle and going back in again, and again checking that I'm not in a vessel. And as I'm slowly withdrawing, I show this, I am plunging in the lidocaine slow and steady towards the top. Good, and then I'm going to angle down towards the beginning of the tear, and I'm slowly withdrawing, plunging in. Good, and then I come out right where I came in. So I've done one side of the tear, and then I repeat that on the other side. So I come in on this side of the tear, and I still have plenty of lidocaine in there, so that's good. And I go in towards the top, and as I'm coming out, I'm pulling out, and I aspirate first to make sure that we're good. Coming out, letting the lidocaine out slowly as I withdraw, but not coming out all the way. Change angles, going back in, and so I'm going along the whole edge of the tear, and there, I did kind of 3 angles on both sides. I take it all the way out. Lidocaine can take 5 to 10 minutes for it to kick in, so I definitely would want to wait that long. Anne Fry says 30 seconds, so I'm not sure exactly about that, but I would definitely want to wait longer to make sure it's working, and it should work for 75 minutes or so, so there'd be plenty of time to do, especially if it's just this little tear. And I would explain to the client, I would document this, and at the end of the tear repair too, I would document all this and clean up, and also just check in periodically as we're going to make sure that the lidocaine is working. If I see the client flinching or acting as if it's not, then I definitely want to stop and check in and make sure they're okay. Thanks.